Welcome back. In this section, we're going to look at some structures which are internal related to the female reproductive system. So by now you've learned structures in lab, so you should be able on both of these drawings, both an anterior drawing on the left and a mid-sagittal drawing on the right, to be able to identify the ovary, the fallopian tube, the fimbria of the fallopian tube, the uterus, and the vagina. So just take a second and find all those structures on both of them. Okay, so let's talk about the ovary for a second. This is where oocytes are made, and the entire ovary is about the size of an almond, except it's white, as you can see in the picture in the right upper quadrant. It has all these dimples, all these little scars on it from every single time you ovulated throughout your life. After the oocyte is ovulated, it only lives a maximum of 24 hours after ovulation and can die even faster than that. And then besides the oocytes or the gametes being produced, there are other cells in the ovary which are responsible for producing your hormones, the estrogens and the progestins, the most common of which is progesterone. So we're just going to use the word estrogen and progesterone from now on. Now, attached to the ovary, there are two different ligaments. Between the ovary and the uterus, attached to the uterus just inferior to the fallopian tube, is the ovarian ligament. And so that holds it so it can't wander away. And then lateral to the ovary, attaching it to the pelvic wall, is the suspensory ligament. And it's through the suspensory ligament that the ovarian artery travels to the ovary, and the ovarian vein would travel away. Now in the female, just like the male, remember that on the right side, gonadal veins drain directly into the inferior vena cava, whereas on the left side, the gonadal veins, both testicular and ovarian, will drain into the left renal vein before crossing over anterior to the aorta to drain into the inferior vena cava. All right, from there, once the oocyte has been released, it's actually released into the peritoneal cavity where it's floating around with this little corona radiata around it. But meanwhile, the fallopian tube has fibria at the end, which are creating currents for it to come into it. And so the fallopian tube has a lot of smooth muscle because it's going to have a mild peristalsis to move a fertilized ovum along its pathway. And when you look at the luminal surface, what you'll notice, it's highly folded. So there's lots of mucosa, so there's lots of surface area with different types of epithelium, two different types of epithelium. Most of the cells, the majority of the cells, are these ciliated cells. Why are they ciliated? To move that oocyte so we can reach Mr. Sperm, because, okay, it's going to be an oocyte, because he wants to get you pregnant. Okay. And then there are some other secretory cells which you may learn about in physiological times. After ovulation, that's when peristalsis of the muscle of the fallopian tube really kicks in, and you get a lot of ciliary activity. So I want to point out something, because most pictures show that if I was the uterus and this was the fallopian tube and this is the ovary, that the fallopian tube fimbria sits right on top of the ovary, thus giving you the idea that essentially the ovulated oocyte is going to be sucked into the fallopian tube, and it could be anything further from the truth. When we see pictures later on, you'll see that it's nearby. So this is going to be ovulated into the peritoneal cavity, and it's the movement here that will create currents in the peritoneal fluid for it to enter the fallopian tube. So you may recall that the uterus is tilted anteriorly over the superior surface of the urinary bladder. There are three different areas: the uppermost fundus, then the main body, and then the inferior cervix, which hangs down into the vaginal canal. There are 3 layers: the outer perimetrium, the muscle, which is the endometrium, and then the inner endometrium. Now, the lumen is not just this empty triangular space like all the pictures show you. And in fact, it's not a hollow cavity. It's collapsed down on itself unless there is a baby or a placenta in there. It's a potential space. So let's look at the endometrium a little bit closer. It's a simple columnar epithelium here at the surface, and we have glands which extend deeper. So the endometrium actually has 2 different layers. The basal layer, or the portion of the endometrium which is closest to the myometrium, closest to all this smooth muscle, this is the stratum basalis. And this is the deep basal layer of the endometrium, and it's permanent. It is always there, okay? There will always be epithelial cells here which can regenerate. Superficial to it, we have what is known as the functional layer, or the stratum functionalis. And this is the layer that grows during your menstrual cycle. And if you're not pregnant, this is the layer that will slough, still leaving the stratum basalis, or that basal layer, behind. We'll see more of the effects of what happens later on. As far as the cervix goes, there is a central cervical canal, and inferiorly there is that external os, which we're just calling the cervical os. In a pelvic examination, when the speculum is put in, it gets centered so that you can see the cervix and you can clearly see the cervical os. If you're testing for STDs, you can put a little brush up into the cervical canal. It's a little painful, can cause a uterine cramp or 2, in order to see if there is anything there to be worrisome. And for the pap smear, basically they are just scraping the surface epithelial cells, which are stratified squamous, off this part of the cervix. So it's just kind of like scraping your skin, only it's mucosa. When you look at these 2 cervical osses on the right, the one up above, you'll notice, is quite small, and it might be slightly oval, but it's more circular. This is what it looks like if a woman has not had a vaginal birth, or had a D&C, or had an abortion where products went through, or a miscarriage where products went through the cervical canal. Once the cervical canal has been totally stretched, as in we're measuring, you are dilated 10 centimeters, this tiny little cervical os, which is normally about 2 millimeters in size, has to get this big, which is 10 centimeters in size, in order for the baby's head to come out. And this never goes back to that. So what you're left with is about a 1 centimeter, a little bit less than a centimeter. And I like to call it a little smiley face because you've been pregnant. Some other people call it a fish mouth, but I prefer the smiley face. So that's what the bottom picture is showing, somebody who's already delivered a baby. When we look at the cervical canal, as I said, this external part of the cervical canal, this is stratified squamous epithelium, whereas higher up in the cervical canal, this is still the simple columnar epithelium that you have higher up in the uterus. And this lowest part of the cervix, what you will notice is there's no smooth muscle there anymore. It's mostly elastic and collagen fibers, and you have to go higher up into the canal to have the smooth muscle. And that's why doing the pap smear doesn't cause any cramps or anything like that. It's only if you get the little brush put up into the canal to try to collect cells and or bacteria from up in there. Now, there are ligaments related to the uterus as well. So we're going to start first where the fallopian tube attaches to the uterus. And as we've already talked about it, just below that is where you're going to find the ovarian ligament going between the uterus and the ovary. Then if we continue inferiorly, we see the round ligament, which actually goes to the anterior abdominal wall and goes into the deep inguinal ring to insert in the mons pubis. And so let me explain what happens and why we have a round ligament. When the female is sexually excited, what is going to happen is that things are going to move around a little bit down there. And one of the things that happens is the round ligament actually shortens, which actually pulls the vagina higher and makes the penis fit better. So this only happens with foreplay. So definitely a round ligament of the uterus is an important ligament. And then the third ligament is all of this stuff here between the ovarian ligament and the uterus, and this is your broad ligament, which basically is like the peritoneal folds in this area. So here is a picture looking at the pelvis from above. The top part is where you would find the rectus abdominis muscle, so this is the urinary bladder. So fallopian tube, find your other three ligaments, figure out which one is at the arrow, and what it's pointing to is this little thing right there. So stop it and label all your stuff on this picture before you move on. Okay, continuing on, let's talk about the pelvic floor for a second, because if any woman's given birth, she understands that things are going to sag down there afterwards, and the Kegel exercises that all the women do are not the only thing. There's actually physical therapy to restore the pelvic floor. So we talked about the levator ani being this sling. This muscle is actually 3 different muscles whose names we're not going to bother learning. And so we have this hammock, which normally holds everything up, but due to the pressures and the pushing with childbirth, and especially the more babies you have, you get a droopy hammock underneath. And physical therapy now has been developed for these muscles as well, and has been very successful. So it's often routinely offered, and it's covered by insurances now for postpartum ladies. So you definitely want to take advantage of this after you give childbirth and not be like those 60 and 70-year-old women whose uterus and everything is falling down between their knees and stuff like that. Prevention is the most important thing. So once again, I have 4 pictures for you to practice identifying. Let me tell you what views they're at to help you. This top one is the uterus tubes and ovaries taken out as a surgical specimen. So this right here is showing the cut surface of the vagina. This is a mid-sagittal view, and you can see the labia as well as internal things. This yellow part right here, this is the pubis bone. This is a laparoscopic picture from above. The white structures are the ovaries, and see what else you can identify there. You should be able to identify all kinds of ligaments on that one. And then the bottom picture is also a picture taken from above with anterior is superior, just like anterior is superior there. But this is more of a cadaver fixed kind of person, and so find all the structures there. And I really like this one because it shows that the fimbria or the fallopian tube are not sitting on top of that ovary. So go ahead and practice with this, and I will see you for the next video soon. Thank you.